Are you ready for us? Okay. So we also thought of chronic diseases because that is the main cost that hospitals pay today for chronic patients that just go in and out for checkups all the time, and you can't always go to checkups, so you have like these 3-month gaps, 5-month gaps. So we have a working system. Well, it's kind of in development, but it works pretty well right now for diabetes, where people measure their blood glucose levels and then automatically send them to the GP. So this is like a successful model of self-monitoring. But since that's been already done, we thought we'd like try another chronic disease. So we first thought about chronic eye diseases, and for instance glaucoma or age-related macular degeneration, diabetic retinopathy. So we figured if you could have Google Glass that looks out, why not have Google Lens that looks in? Why we chose glaucoma is because measuring blood pressure is quite easy, but measuring blood eye pressure is really difficult. Because if you've ever worked in an eye clinic, even trying to measure someone else's eye pressure is quite annoying. But imagine doing it for yourself. But then you have Google Lens, which is, by the way, already sponsored and patented, so there's no way you can steal it. Which is against your eye, because if you want to measure eye pressure, you have to go against the cornea, but this is already against your cornea. So, I don't know, you can send some pulse out or something, and then you can measure the eye pressure. And why not go crazy? Why not actually take pictures of your optic disc? If you have glaucoma, you have risk of optic disc damage. You could also have daily ETDRS scans, which are these, these huge tables with like the big letters that go smaller, and then you have to see so what do you see in that line and that line and that line. So, for instance, maybe once a day, it just projects out an ETDRS table and it just lets you read them out, and then the information goes directly to your GP, which is a great way to measure if your age-related macular degeneration is getting worse. Because the way to measure A and B damage is usually optical coherence tomography, and let's be realistic, this can't do that. So you will have to go to the doctor every about 5 months maybe, just to do your optic scans. And it also has revolutionary UV Protect software or technology, because excess damage from UV light can cause macular degeneration. So obviously, if you're in too much sunlight, the lens gets a bit darker. That's it.
And actually, I can also talk about how this device ensures that you have taken your pills. First, it has to detect that you have taken it. I mean, it can use the thing that Oliver talked about, image recognition with the feet. It recognizes you taking the pill. But this is not too foolproof. You can do that and spit it out. Plus, big brother. So the other option is, to the scans, high resolution scans of your eye. And I guess I am not a doctor. I don't know anything about medicine. But I guess most medicines have some effect on your eye, maybe some minuscule effect even. But if it's a high resolution scan, you can use some cool machine learning techniques to detect that you have taken the pill. Or you can put something in the pill that will make some small changes, which are not harmful in any way.
Yeah, and
so,
actually,
okay.
That's how we came to this idea. Is that that's where we started off. Because if you want to make sure if someone's taking eye drops, well, you can just the lens can measure if you've got the eye drop on it, but also the point of the scan is just to see if you're getting worse and worse, chances are your medication is working but you're not taking it. So.
Okay, and this is part one, how to detect that you have taken. Part two is how to ensure that you take it now that you have forgot or don't want to take it. One option is to project on your eye a nagging doctor, So everywhere you look, you have a doctor. Take the pill, take the pill, and just, even if you close your eyes, the lens is inside your eyes, so you can't So this is it.
It's basically cool.
Does it work as a regular lens, or do you have to wear extra glasses if you have some?
It's thinkable, a bit crazy, but thinkable.
What about the regular lenses? You have to clean them and change them. What about those ones?
We already have yearly lenses, so I'm guessing this is going to be kind of you can sometimes. I think you do have to clean it sometimes, to get better quality vision
and to sell more.
No, I mean you can use the same lens. You just have to clean it every now and then. You don't have to throw away your laptop every time you clean the screen. So.
How does this lens give the energy?
Solar energy, obviously.
It's wireless energy.
And that's also a side effect of UV protect technology because it gets darker and dark matter absorbs more light.
Yeah.
So, yeah.
Okay then, thank you.